More analysis now of Sydney's decision to continue on with its lockdown for another week. We heard the big news conference earlier today with the New South Wales Premier, who said this is Sydney's big chance and only chance, Gladys Berejiklian said, to ensure that the city doesn't have to endure even longer and more frequent lockdowns down the track. Let's bring in Natasha Robinson. She's the health editor at the Australian newspaper. Natasha, poor old Sydney, so many businesses, so many families really feeling the pain of this decision today, but I guess not really a surprise when you look at how these numbers have been bouncing around and so many cases still being out and about in the community while they've been infectious.
Yeah, that's right. That's one of the unexpected things, I think. We expected cases to bounce around a bit as the Premier Gladys Berejiklian keeps warning us that they would, but I don't think we expected to see as many cases as we did see today out infectious in the community. And what's clear is this isn't people going out for their essential shopping or exercise, it's people doing the wrong thing, visiting other households, mingling, and spreading the virus. That was made very clear, and this seems to be a particular problem in the southwest of Sydney. So there was an acknowledgement today that the messaging hasn't been good enough from New South Wales Health and from the government. I think that they're going to have to improve that a lot if we're going to get this message through to the community that you just can't mingle with family. It's something that everybody has to get those messages, and some people may not even be tuning in to the mainstream media. So that's certainly a challenge. They're reaching out to religious leaders. They said they're talking to mayors, but this is going to be really critical in the next week that we do see that message really filter down to those communities.
Because as authorities keep stressing, we're dealing with the Delta variant here, and we learnt today about how it is affecting younger groups of people. There was the warning from the Chief Health Officer, Kerry Chant, about the amount of people who are in hospital with this. 8 people under the age of 35 in hospital, a person in their 30s and another in their 50s in ICU right now with COVID in Sydney. And that all comes as the new data shows us that the vaccine efficacy isn't as strong against the Delta variant.
Yeah, that's right. And I think that was a very concerted message by Kerry Chant today, outlining those statistics, letting people know that they shouldn't feel comfortable in the fact that this is a disease of older people, that you've got one person on a ventilator in ICU who's aged in their 30s. That's a really sobering message, and I think that's a message that Kerry Chant did want to get across very strongly this morning. I think what is quite concerning, though, is it's very clear from the New South Wales government at this point that they're not going to extend this lockdown any further. So what happens? What do we do if this trend continues? The lockdown just isn't working to keep people out of the community in their infectious period, and we come to a week later and we're still in the same position. I hope that's not going to be the case, and very likely that the lockdown will start to turn those trends around. But you saw the door left open there from Brad Hazzard. I think it was quite telling when he made the admission that we can't keep going into lockdowns, and we may reach a point where we're going to have to accept a level of virus spread in the community. I think that's what nobody wants to see, that, especially not when you're seeing people start to go into ICU, start to go onto ventilators. They're the trends that we don't want to see, and we've just got to hope that the next week really delivers us, reducing those case numbers, and particularly those numbers of people infectious in the community.
Natasha, hindsight's a wonderful thing, and we're looking at the rear vision mirror a bit here when we talk about whether or not Sydney should have gone into a lockdown much sooner. The lived experience of other states recently has been to go hard, to go early, and we've seen states like Western Australia, Queensland, Victoria do that and get on top of COVID outbreaks pretty quickly. We saw the Premier asked about that today, whether it was a mistake not to go in to a lockdown earlier, and she was really defending the stance that she took. Was it a fair enough defence, do you think?
Well, I did hear Mary Louise McLaws just then express the view that if New South Wales had gone a little bit earlier with the lockdown, we perhaps wouldn't have been in this position. I think you need to listen to what Kerry Chant is saying. It's one thing for Gladys Berejiklian to defend the decision and deny that that is the case, but when you hear Kerry Chant saying she doesn't think that it would have made a hell of a lot of difference, I think that's we really have to respect that and listen to her wise counsel there. Nobody can say that we wouldn't have been in this place if the lockdown had been a few days earlier. I certainly think some of those so-called circuit breaker lockdowns in other states have been unnecessary. And Kerry Chant made clear at the, weeks ago that going into a 3-day lockdown, she didn't believe would have made any difference whatsoever in New South Wales. So it's just hard to say. Nobody knows what would have happened if it had, the lockdown had been called earlier. But, New South Wales Health seems pretty comfortable with the decisions that they've taken. And they are taking some measure of confidence. I would think at this point that 1 week is going to be enough to get this under control. But as I say, we've all just got to hope that that's the case, because businesses are suffering very badly. People are, not getting paid. There was a lot of pressure on Gladys Berejiklian in that regard this morning. What is the government going to do to support those people? And all of those, I think you saw a really marked shift in the press conference this morning. A lot more. It was a lot more robust, the questioning, and a lot more rowdy than we have seen, and that's just going to get more acute as more people face the prospect of their economic insecurity because of this lockdown.
And as the New South Wales Premier said earlier, the onus now really on Sydney residents to do the right thing, to follow the rules. And she said if that happens, everything will be okay. Fingers crossed. Natasha Robinson, appreciate your analysis. Thank you.
Thanks, Ash.